Hello, I'm Nick Cameron, the Head of Prison Service and Prison Governor. Just want to talk today a little bit about mental health and the support we're putting in place for our staff, not only as Mental Health Awareness Week, which is happening this week, and we're really supportive of and pleased that the focus is being turned to mental health of both our staff and our prisoners. Mental health is hugely important to us as a prison service. Many of our prisoners will have mental health issues, and the type of environment we work in with a prison is often managing some quite challenging, difficult individuals in a quite stressful environment. So it's important the well-being of our staff is looked after. As a society, we tend to focus very much on physical health, and we talk about people who are unwell, we talk about things like heart disease, breast cancer. One of the things we least talk about is mental health and the mental well-being of our colleagues, our family and ourselves. And it's really important that as a uniformed service we're able to openly talk about mental health and well-being. It's not a taboo subject. It's the most complex part of our body and probably the least understood, and it's really positive that we're now having the confidence to openly discuss, openly address and put in place some measures with our staff. We're just in the process at the moment of having 30 staff undergo mental health awareness training to increase their skills and their ability to look after themselves and look after colleagues and look after prisoners. And we're also then going to have another 12 staff on top of that who will be trained as mental health first aiders. And this is a course that's being provided by Mind, working with the states of Jersey Prison Service to train our staff to a higher level, and I believe that will make the prison a safer place for prisoners, and then we'll have staff better trained, better attuned to mental health issues, and also more sympathetic, more understanding, and also in terms of their own well-being and colleagues' well-being. We'll have 42 staff who'll have a much greater skill set and awareness. For me personally, like everyone, my family have been affected by mental health issues. Sadly, my grandfather committed suicide. Obviously that affected my mother, and I was aware of it in my childhood. So like most families, we probably have been touched by mental health, and there's probably many of your viewers today who will have family members or themselves who've been touched by mental health. Mental health affects 25% of people during their lives, and we do need to recognise it and deal with it individually as well as an organisation such as the prison service. So looking after our own personal well-being is hugely important. Staying fit emotionally, physically, mentally is a vital part of what we do in a uniformed service. And for me, I try and stay fit with some exercise, not as fast as I used to be running, but still try and do some running, try and make sure I look after my well-being. I have a great supportive wife and family, and that allows me to cope with the challenges. And important, I have a number of avenues of managing stress and de-stressing and dealing with anxiety and challenges. And it's important we each develop that skill set and coping mechanism to operate as part of our daily lives and as part of also our roles in uniformed services.